Good evening, everybody, and welcome to another segment of Let's Talk About It Live. I am your host, Felicia Hopkins, and my co host here,
Michelle Peterson.
we are so glad to have you all join us today. Let's Talk About It Live. Michelle has been on since June.
Yeah.
June was our first episode,
Mm-hmm.
and we've been going strong ever since. We want to take this moment to thank Edgewood family. For everyone listening on Edgewood family, hello. Here we are. We are on your platform. We are in your neighborhood. We are in your backyard tonight. And we want to thank the administrators that gave us this opportunity to be able to share health and public health to the Harford County community, especially from our program, the Minority Health Program. Also, we want to give a special shout out to James Bear. We know that you had surgery, either if it was last week or a week ago, and we are praying that you are recovering well. We're sending all of our prayers and well wishes to you for not only a speedy recovery, but a recovery that will bring you back to the forefront. We miss you out here. Also, we want to bring attention to the other administrators that are on here, Cherie and Everson. Who is the other young man, Michelle? There's one more. I can't
It
remember.
is. I
But
can't
what I
remember
want you
just
to know, we see you. The Harford County Health Department, we see you. And we see the work that you're doing out here to bring awareness as far as health to um, the Edgewood area. And we commend you for your work.
Yes.
So today we have some special guests we're excited about. But before we do that, we have some announcements. We're getting thrifty with this, guys. We're getting kind of tech savvy here.
Yeah, we're learning.
We're learning. So just give us a minute and we are going to put it on.
Since tonight's broadcast will be about maternal health of prenatal care, we want to make sure that all Harford County residents are aware of the support services provided by the health department. If you are pregnant or a new parent, WIC may be the perfect free nutrition program for you. WIC helps women, infants, and children eat better to have a healthier future. If you have any questions or want to get signed up, call the Harford County WIC program at 410-939-6680. Also, if you are pregnant or a new parent and you just don't know where to start or need to get connected to the right resources, the Harford County Health Department's Megan's Place in Edgewood is accepting referrals and enrolling clients. Beginning April 4th, they will be reopening its doors to allow more face-to-face interaction. For more information, call 410-612-1777. On another note, Thursday, March 31st, Felicia and I are hosting a smoothie sip and paint at the Edgewood Epic Center. We plan to discuss healthy ways to make smoothies while we distress with painting. Due to a limited supply, please register to secure your seat. We hope to see you there. April, we are partnering with the Boys and Girls Club to host a lock-in for teenage boys. This event will be filled with fun and address mental health in the family. So stay tuned for more information. Also, if you want to see our upcoming events, go to harfordcountyhealth.com to view more of what we're doing next. Just click Upcoming Minority Health Events. Now that spring has begun, I know many of us are excited about the warm weather and may be planning to get out more, especially since the COVID numbers are still low. The health department wants to encourage you to continue to be safe, and if you are not feeling well, please don't hesitate to get tested for COVID. Although COVID testing sites in the county are closed, you can still get a rapid and PCR COVID test at the Maryland I-95 Travel House, which is located at I-95 Aberdeen, Maryland 21001, Monday through Friday, 8 a.m. to 5 p.m., and Saturdays, 8 a.m. to 1 p.m. If you are looking for additional places to be tested, please visit our website at harfordcountyhealth.com and you will be able to find more testing sites. Please be safe.
Michelle. All right. Missy. All right. That's beautiful. Guys, listen, we are learning as we go. And we
Yes.
are excited about every announcement that you just saw. So tonight's topic is about the importance of prenatal care. The statistics in Harford County have shown that the high number of infant mortality rate and also the high number of those that are not going to see their doctor when they become pregnant. It is so important that you take care of your body. You are important to that life that you are carrying. And to that end, we have brought on some special guests. One, Dr. John Samson. He is the associate professor at Johns Hopkins University. And when he comes on, I'm going to have him share more about himself. And also, we have another special guest. Her name is Felicia McCoy. And yes, she has my name as well. And she is a doula. And she has over 20 years experience in the field. And so I want them to come on one at a time, and they're going to discuss who they are and what they do, and we're going to ask them some questions. During our discussion, feel free to put information in the chat. Feel free to ask us any questions on Facebook and YouTube. We do have some people monitoring it. Feel free to share your stories. We would love to hear them. So without further ado, we're going to bring on Dr. Samson. Hello, Dr. Samson.
Hello, how are you doing?
Good, good. It is so good to have you to join us today regarding this very important discussion. I've known Dr. Samson for, it's been about maybe 6 years now. And I just want you to let the listening audience know a little bit more about who you are and what you do.
Okay. Yes, my name is John Samson. I'm an anesthesiologist. I'm also a critical care specialist at Johns Hopkins University Hospital. I also do participate in the Upper Chesapeake healthcare system from time to time as well. My focus is in basically three main areas. Although I do a little bit of everything, my primary areas are neuroanesthesia, working with people who are having neurosurgery, critical care medicine, working with people who are on life support in the intensive care unit, and then obstetric anesthesia. Several times a week, for those entire days, I'll be just working with laboring women who are either on the labor floor or else that need any kind of operation that would be necessary for a woman who is pregnant. And of course, the most common operation is a C-section, but that's not the only one. And there are some other surgical conditions, needs that some women need. And ironically, some of those things can only be planned and executed in an organized way if the woman has prenatal care, so that she can be identified that either she or her fetus or both need these types of interventions. And so I'm also, the other area I focus in is international medicine. So I try to serve as a bridge builder between healthcare in the United States and healthcare in Africa. And so one of my focal areas right now is working on improving obstetric care in West Africa, particularly in the countries of Liberia and Sierra Leone, where their risk of death during childbirth is so high in those areas that if you take a random group of women that you may encounter that are of childbearing age, you can predict that 1 out of every 10 of those women will have a lifetime risk of death during childbirth. And so one of the strategies that we have for improving care to them is improving access to obstetric care, but also access to prenatal care as well.
Wow. I think that's such an important issue, and we really appreciate the work that you do over in Africa, and your focus on prenatal care and the health and wealth of our minority population. So we're going to get into some questions after I bring on our next guest to include in this discussion with us, and her name is Felicia McCoy. I think she's ready, and I will let her give her introductions. Hello, Felicia. How are you?
Hello, how's everyone?
We're doing good. We're glad to see you.
Thank you
If
for
you can give
having me.
us a little bit more about yourself and what you do.
Yes, hi, my name is Felicia McCoy Laguerre. I am a doula, trainer, coach, herbalist, um, and I have been working in uh, women in public health and specifically maternal health for over 20 years.
Excellent. So thank you so much for joining us, and with both of your experiences, I want either one of you to just help us answer some of these questions that came before us. The first is, even as minority women, young or what I'm talking about, like teenagers, those that are not married, what would be their first steps when at a young age to about approaching prenatal care? Anyone?
Well, one of the first steps is to basically figure out how you're going to connect with the healthcare system. So most people do that by they might start with their primary care physician if they have one, and then he would refer them to an obstetrician, or else they can look up obstetricians in their area. If you live in Harford County, you might start by accessing the birthing center at the Upper Chesapeake Medical Center. And so there you would access them, you make an appointment, and then they would um, meet you and figure out what your accurate dates are to help figure out, so you can figure out when you would be expecting to have your baby. They would talk to you about the kind of birthing experience that you would like. Some people work more on the midwife channel, and some people work more in the obstetric channel, and some people want to have a doula. And so all of those can be determined as well. And then they can talk to you about, make sure you're comfortable where you're going to have your baby. At the same time, they put you on a schedule in terms of taking your prenatal vitamins, a schedule that incorporates when you're going to have your ultrasound. Um, and the ultrasound has purposes beyond just determining whether you're going to have a girl or boy. The ultrasound has very important predictive factors in terms of, whether there could be any problems with your with the fetus. And in some cases, in many cases, those if there are any problems, though, some of those problems can actually be intervened with either medically or surgically. They can also determine whether or not you have more than one baby. Okay, so that's an important risk factor. If you're going to have if you have multiple babies inside of you, then that has to be planned specifically to make sure that there's no complications from that as well. And then when you get closer to when you're going to have your baby, they'll be wanting to keep looking to make sure that your baby is oriented within your uterus in the right orientation. And so if it's upside down, for example, there are procedures that they can do, which we as anesthesiology partner with them to do, where they actually without any surgery, but with some anesthesia to make sure you're comfortable, they turn the baby attempt to turn the baby right side up. And the anesthesia not only makes you more comfortable, but it makes your uterus more relaxed to make it more likely that that procedure may be successful, as well as we're there in case there's a complication to that procedure, which would require you possibly to have a C-section need. So those are, so that kind of gives you an idea of how you first access the system and what the system, what is the reason why you're accessing the system.
Now, I need y'all to listen to that. Did you hear those things? This is very important. I know that there's some listeners out there that assume, yes, this is very elementary. I know I have to go to the doctor. I know I have to get prenatal care, but there's a lot of people out there that are not getting prenatal care and they don't feel that it is important. Michelle, go ahead and hop in.
Yeah, you see, I'm ready. I just wanted to back up a little bit. And can someone tell us what is the difference between an obstetrician, a midwife, and a doula? Because some folks really don't know the difference.
I'll kick it over to Felicia for that. She sounds like she's
Okay.
an expert in that area.
No problem. An obstetrician is a doctor who specializes in dealing with women who are pregnant. And they take more of a medical approach. They also may be the one that actually delivers the baby if in the hospital. A midwife is someone, is like the go between the doctor, the obstetrician, and or the doula. She's the person somewhat in the middle who may work regularly with mom on her regular prenatal visits, making sure the baby is growing the way he or she needs to, making sure that she hears the heartbeat regularly, informing mom, on things to do to help strengthen her pregnancy. And she's like a nurse, basically. In layman's terms, she's a nurse. She could be a little more than a nurse. She could be a certified nurse practitioner, but generally they work alongside the obstetrician. They also can work with a doula. A doula is someone that works with pregnant mamas to ensure that mom knows about pregnancy terminology, layman terms, stuff the obstetrician or the midwife may not have time to necessarily explain. When they go into medical facilities, they have limited amounts of times they can spend with the obstetrician or the midwife, whereas the doula, such as myself, we're going to ask those questions. What issues are you having? We're going to go into detail. We're going to look at health history. The doctor may do that as well. The midwife may do that as well. But the doula is going to take her time. She's more like a coach. She's coaching her through every stage of her pregnancy, making sure she eats healthy. She knows all of her choices, all of her options, whether
Oh, no, I think she froze, but that's okay. We'll bring her right back
through the
on.
medical society or through a whole. Can you hear me now?
We can. It just froze for a minute.
Okay, awesome. So the doula works with mom. She's coaching her through the stage of pregnancy. And she's not just coaching mom, she's coaching her significant other that may be there as well, preparing them for the delivery room. Just and letting them know all of their options and preparing them to ask questions when they go to their prenatal visits and so forth.
Oh, okay. Good.
I think that's this is good information to know, that you have options when you are pregnant. You have options, and you can seek out what makes you more comfortable when
Absolutely.
you are delivering. The other question that we have here is, you did answer. You answered about they do ask you about your medical history. They ask
Absolutely.
you about your family history as well. That's very important, especially for patients that might have sickle cell trait or someone in their family that they might not know that has sickle cell trait. It's good to know that you come to the table with some family history that they will be able to explain, and be able to let you know if your partner is tested for sickle cell as well. I know that Dr. Samson knows a lot more about that than on that topic than I do, but those things are very important. Um, to pivot a little bit, I know that I have three girls, and my old the I had a daughter back in 1998. She died. She died while I was pregnant with her. I had preeclampsia. And for those of you that don't know what preeclampsia is, I'm going to let Dr. Sampson and our doula explain to you what that is. But I have preeclampsia, and I remember being in my 6th month. And I'm sharing this story because there might be some others out there that might need to hear this, that they can understand some of the care that they might receive while they're in the hospital. I was 6 months pregnant. Um, I had protein in my urine. Uh, my blood pressure was high. I was seeing stars, and I had to be hospitalized. Long story short, I was in a particular hospital. I will not name the hospital at all, but I was in a particular hospital. I was experiencing that pain. I was doing everything that I was supposed to be doing, laying on my left side, making sure that I didn't get up and do a lot of movement. And I was experiencing pain this particular day that was really unusual. And so I let the nurse know. And the nurse was saying, well, maybe it is that, the baby's just moving around. Let me see what type of pain medication that you can take so I can make you more comfortable. But I kept letting her know that it was like I was in a lot of pain. Like I felt like I had to go to the bathroom. And she encouraged me not to get up. I laid there. This was like maybe 1 o'clock in the afternoon. And the reason why I remember it was 1 o'clock in the afternoon, because I had a friend visit me from out of town around that time. Later on that evening, the pain was so excruciating. The nurse finally came in. I'm complaining. She took a Doppler reading of the baby just to check the baby. No heartbeat. They left the room, and she said, well, maybe this Doppler's broke. And she went back and got another Doppler. No heartbeat. Went upstairs. She took me to obstetrician to do an ultrasound. The baby had died. I was in a lot of pain. I was devastated. And this leads me to, it was a very devastating experience for me not to be taken seriously regarding the pain that I was experiencing. And leads me to the next part of our discussion is, as minority women sometimes, or just some women sometimes, our pain is not taken seriously, and how we need to advocate for ourselves when we're in these situations. Could you speak to some of those things that you might have seen or heard? My situation ended, well, thank God I lived, but my baby did not. And I feel as though it was due to the neglect of the hospital not being as attentive to my pain. Have you heard stories about that?
Ye- Well, not just heard, but also seen stories of that. Um, do you want? Should we start with about what preeclampsia is, and then move over
Yes,
to
talk
that? Or
about what
okay,
preeclampsia is, because it's
right,
been a while. So I
okay,
need one is to hear the right information.
okay. So there are medical problems that you can harbor, that you can have, like high blood pressure, diabetes, heart failure. Whereas you get pregnant, you have these medical problems, and the pregnancy may actually interact and interface with the medical problem. The medical problem interacts with the pregnancy.
Mhm.
Those things need to be managed because they can have serious consequences. Diabetes can result in your baby becoming so large that there's literally no way to deliver them but to have a C-section, and where the baby would be born, and as soon as they're born, drop their blood sugar to a dangerous level. So how can you know that unless you get prenatal care?
Absolutely.
Other conditions occur specifically when you're pregnant.
Mm.
There is a type of heart failure that can occur just when you're pregnant. For example, And there's also preeclampsia. And preeclampsia is a certain type of high blood pressure related disorder where you have three main features. It starts out with just three main features, but how severe it can go is way beyond that. The three main things it starts out with is number one, high blood pressure. Number two, swelling of your hands and feet, which sometimes can be like, how can you tell? Because they're a little bit, pregnant women maybe appear a little bit more swollen anyways, but a lot of times you can tell. It's just more than what it normally would be. And number three is something that's more quantitatable than that, which is protein in your urine. So those are that's the classic triad, shall we say, of preeclampsia. And each of those has more severe things associated with it. The headache that you can get can be because the blood pressure becomes so high that it's at risk of causing a stroke. The protein in the urine can develop into a situation that causes you to have liver failure, bleeding disorders, and failure of your kidneys if it gets out of control. In addition to that, imagine someone who already has high blood pressure and then they get preeclampsia. Now it becomes even more complicated in terms of managing this and differentiating perhaps things related to their blood pressure being too high and before, and now the preeclampsia that now has occurred. And all of those things affect the circulation that is providing blood flow, nutrition to the growing baby that has to go through those blood vessels in the placenta. And now the blood vessels have been made not to function normally because they're dealing with such high pressure. And it turns out that sometimes, for some people who are at risk of it, something as simple as an aspirin per day can actually prevent sometimes preeclampsia. Not in all patients, but some. But how would you know that? How would you do that unless you get prenatal care? Now, once a person has any kind of a condition where you're interfacing with the healthcare system, you have the situation where healthcare providers may not be listening to you, where healthcare providers may not be listening to the pain that you're having.
Right.
Where they may not be responding to you properly, and you have to differentiate that from that, wait a minute, I want the healthcare provider to do X, Y, and Z. Well, that's different. I mean, I often tell patients that I'm not at McDonald's. I can't give you everything that you want. If I tell you that this is something that we need to do, and you tell me that I just don't want to do that, I want to do something different, and I'm serious, like this is the medical thing that needs to happen now, then you sort of have to listen to that. It's not just what you choose. At the same time, if you're telling me that you're having pain, you're having trouble breathing, something different's happening to your body that's unusual, then I need to also listen to you. Okay? Literally, I have a hand-drawn painting that I was given last week from a patient, not a pregnant patient, but a patient nonetheless, who the nurses weren't listening to. Hey, Nate, can you check the dogs now? Okay.
Look, we're all at home. Life happens. It's okay.
Yeah.
Nate, just hurry up and make a transition, whatever you're doing, okay? Who the nurses weren't listening to. Believe it or not, the patient, and this is a cultural issue as well. Can you imagine this patient is a dean of one of the major medical schools in Lebanon. He
Wow.
speaks four dialects of Arabic and is an English teacher and Arabic translator. But
Wow.
because he asked his son, when the nurse said something about his IV, he said, what's he talking about IV? And his son said what the IV was in Arabic. The nurse took it upon himself, it was a male nurse, that we had to redo every consent with the patient for surgery and anesthesia with an Arabic translator,
Wow.
regardless of the objections that the patient had.
And
So
see,
it was embarrassing to him. It's like, I am a translator. I
mhm.
teach English. And yet this person was just ramming this down, would not listen to them, actually wouldn't even listen to me. Just decided that, and because I advocated for the patient was so grateful. he actually hand painted a picture and left it the next week.
But
And it was just an example that this nurse looked at the patient and made a stereotype and just decided that no, I don't care how well the person's speaking English, what his background was, that he's the dean of a university. I actually don't care. I want him to have an Arabic translator. The guy was actually, when we were talking to the translator, the patient actually translated what we spoke back to the translator in Arabic.
so, Dr. Sampson, these are the things, just what you described. There's so many
Hmm.
different levels of care that people are getting or not getting. And so that's the other side of the coin. The other side of the coin is you got a medical professional that is talking to another medical professional that needs care, and you have this dynamic going on. And so even from our perspective as minority women, we've been hearing a lot, and I know Felicia can speak to this, of the type of other care that we might get or how we can better advocate for ourselves in these situations. So
Mhm.
this is why this discussion is so important. And not only do we need to understand why prenatal care is important, but we need to understand that when you're behind those closed doors, what you should be expecting, and so go ahead, Felicia.
I wanted to jump in. I mean, we know that there are extreme health disparities when it comes to the African American population or people of color. And that is very disheartening. I wanted to say, Felicia, I had, uh, you know, I thank you for sharing your story. I also have a rainbow baby, a baby that I lost at about 19 weeks, and I'm in maternal care. I was dealing with some of the same things. We're not heard the same. There is such a varying distinction between our counterparts and the needs that we have. That's why um, it's important to have a doctor, a midwife, and a doula, so that you have various levels of people you can go to. As a doula myself, one of the things that I would advocate for the mom is, how is your high blood pressure? But not only that, if we're talking about pregnancy, we need to begin to talk about dealing with the woman's life cycle. What's her mother's history? What was her history? What was her mother's history? What other health issues did she have or does she have prior to pregnancy? And let's begin to talk about what we're going to do to prepare for pregnancy.
Mhm.
Because most often we talk about getting care once you're pregnant, but we have to remember that we have to continue to have care before pregnancy and during pregnancy, and we have to be able to be our own advocates. We have to be able to
Absolutely.
speak for ourselves. We have to be able to say, yes, my mom had sickle cell. Yes, my mom had high blood pressure. I don't currently have high blood pressure, but these are the symptoms. Or if you had previous births, knowing what you went through. Of course, every pregnancy can be different, but previous pregnancy can be like a Rubik. It can give you some measure of what to look forward to, what to expect. Um,
Mm-hmm.
and so we definitely have to look at all of those things, especially the life cycle when preparing for pregnancy. So if we had a young lady, we would begin to talk to her about her health history, and um I, as the doula, often ask, how are you today? How's your weight? How's your high blood pressure? How are you feeling? Are you eating healthy? What medicines are you already on? All of those things are critical, because pregnancy in itself is critical. It's
Mm-hmm.
not something to be taken lightly.
So look at this, Felicia. That is excellent information. And Dr. Samson, thank you for that detailed explanation and examples. Um, I did not know until I got pregnant that my grandmother, my father's mother, had preeclampsia with all her babies.
Wow.
I did not know until after I had my second daughter that sickle cell trait ran on my father's side of the family. Had no idea. And so this information is important for prenatal care. It is just not an easy walk in the park, but it can be made easy with the simple fixes of getting connected to a good doctor. If you don't have proper medical assurance, the Harford County Health Department has those resources. You can go on our Facebook page, you can go on our web page and reach out to someone there and get enlisting. And Michelle and I's information is always listed. So you can give us a call, or our care coordination team with Kim Prout, and they can give you the proper prenatal care that you need and connected to the proper prenatal care. We have Megan's Place. Okay.
Mhm.
So we also have One North Main, which has not only help with women that are pregnant with their children, but dental care. And Dr. Sampson, could you speak to the importance of dental care and
Mhm.
pregnancy as
Very
well?
important.
To dental care and pregnancy, I'm
Mhm.
not sure I'm an expert in dental care in pregnancy. I think dental care is important overall. I think that when you have bad teeth, it allows more of those bacteria to get into your bloodstream. They've also found that heart disease actually is much worse for people who have very poor dentition. Um, but I think those are the main things that probably relate to dental care. I don't specifically see a lot of problems that I'm interfacing with in terms of that. The problems I'm interfacing with more often relate, because I'm more on the anesthesia side, then I'm dealing with more of the problems that are going to be major medical disturbances or major obstetric disturbances to the women. When I was training, and unfortunately, sadly, when at the time that I was finishing up my anesthesia training was during the crack epidemic of the 1990s, and so I think there's so many horrendous things that I saw during that time of women coming in straight from situations where they were abusing drugs right into the labor and delivery floor with no prenatal care at all. That I actually literally reflect on that every time I see medically complicated patients, because I never see anything as serious as I saw in those days.
Mhm.
To see a woman who would come in from, let's say, a house where they were using crack and no prenatal care, needing a stat C-section, and during the C-section, we're discovering that she has triplets. These are like, really like because the woman, because the time that the woman came into the door to the time that we're engaged in an emergency is, there's no time. Like you're just running, so these are really serious things. So one of the most important things for me is not using any drugs, you know, abstinence as much as possible. One of the hospitals I work at is the Bayview, Johns Hopkins Bayview Hospital, and they have a special substance abuse program for pregnant women. So I manage a lot of pregnant women who have problems with anything from cocaine to methamphetamine to heroin. Uh, and one of our recent C-section patients literally had, she needed a stat C-section. There's no IV access you could possibly get from a regular IV. I was able to use critical care skills to get a special IV, and we're able to get that managed. But those are very extreme. It's not cigarette smoking, alcohol use, marijuana use. The pregnancy is a time to do this, for yourself, and do this for your baby, do this for your future family. And this is where a doula can be hugely important in terms of eating right and stuff like that. I would love to connect with Felicia more, actually, because what we're trying to do, even overseas, I don't see the doula as part of that equation. And I think that actually could be a secret sauce in terms of making a difference, in terms of some of the exciting things that we're doing there. So because I think that getting on the right track with nutrition and your own well-being is important. And brushing your teeth and taking care of your teeth is just part of that whole equation to me. Mm-hmm.
Absolutely.
Yeah, what I mentioned that for, and that is really important. What I mentioned that for is because the One North Main was created with the dental unit because of course, the bacteria that is growing in your mouth gets into your bloodstream, and it can affect the
Absolutely.
baby. And so, dental hygiene while you're pregnant is very important.
Yeah,
Um,
and Felicia, a lot of people don't know when they have medical assistance that the dental coverage, they will cover your dental under Healthy Spouse just to make sure your teeth are healthy while pregnant.
Absolutely. And as well, Michelle, a dental appointment is critical. You should be pushed to the front of the line because they know if you're pregnant, that can cause you to have preterm labor as well. Because it's connected to your heart, directly connected. Your teeth and your heart are directly connected. We don't want any disparities. So we certainly want to reduce them, and having healthy teeth is a part of that. I also wanted to add that doulas now are covered by the state of Maryland. So you can get women can get doula care throughout. If she has medical assistance, doula services can be paid through medical assistance as well now through the state of Maryland.
oh, that is so awesome. That is so awesome to know. Um, that doulas can be covered under your medical assistance. Along with those lines and being able to have that doula, I was reading some information about a new program, and it's in St. Louis, Missouri, called Elevate, and they found that the infant mortality rate was went to zero when they were able to meet with minority women in a group. They had a group setting where they all met each month about their appointments, their care, because they were able to talk and communicate with each other. They had doulas sitting there with them as a group, and they
Yes.
were discussing. They said they had no low birth. Um, is it low birth? They had no low birth
Preterm
pregnancies,
labor.
no preterm labor,
Okay.
and that all of them carried to term.
Awesome.
And so the benefits of having not only someone that looks like us caring for us, but a group of women going through the same thing together, giving that same energy and making and looking after each other as a group is something that doesn't cost any money to do. It is just something that is strategic and making sure that our babies live.
Mm-hmm.
So I would love for you and Dr. Samson to connect on that as well,
Yes,
because
I
I
would
know
love
that
to.
you train doulas and all, and so you also do the herbal medicinal aspect as well. Michelle, go ahead. I know you have
No,
a.
I was just going to say, I found something interesting when I was watching that video. They said that you should wait 18 months after having your baby before getting
You,
pregnant again.
that's a part of that life cycle.
Right. And I never knew that.
Yes.
That was very important. And then also keeping all your appointments, no matter if you're sick or not, or if you feel well or not, because
Wow.
something you might not feel anything at that moment, but just keeping a check on that baby is what's very important. And if something was to happen, the doctors could catch it quickly.
Yes.
Absolutely. We definitely have to know the difference between uh Braxton Hicks or labor. So
Yeah.
we really have to know where we are, what stage we're in, the symptoms of each stage of pregnancy. It is so, so critical. I also will add that I know you all mentioned some of the resources that are in Harford County. There is a program called Healthy Families America. They are a program through the state, through the Maryland Child Department, Governor's Children's Services, something like that. But
I'll send it for
they
you.
have community health workers that
Mhm,
are considered to be doulas as well.
mhm.
And that's something I know that's throughout the state of Maryland.
Yeah. And if anybody wants to get connected to Healthy Families, they can connect with Megan's Place and they'll help them get connected to Healthy
Awesome.
Families and all that other stuff.
I love to hear
Yep.
that.
And also, if you need transportation through the Link Bus, we're throwing that out there. We have transportation vouchers for you. Okay, we have transportation vouchers for you. Reach out to us, getting to appointments, getting to even a job interview. So we're here for you.
Yes.
Um, I don't know if we have any other questions. I'm looking here. I think that we answered quite a bit of them. And again, I am so thankful for you, Dr. Samson, and your expertise every time you come on. And Felicia, we want you to pop up and be a guest on with us again with your information.
I would love
If you
to.
wanted to make any personal announcements, Dr. Samson, you can make any announcements that you like, and I'll let you go next, Felicia.
Well, no announcements related to this. Felicia and I are both in the Havre de Grace Rotary Club, and the Rotary Club has been serving Harford County for 100 years as of this year. And if you look at the foundational plaque at Harford Memorial Hospital, you see Rotary Club right there amongst the organizations that helped to build the hospital. Was up until the building of Upper Chesapeake the only place besides home that you could have a baby in Harford County. So we will be having our centennial celebration in May at La Banque La Fleur, which is a historic bank in downtown Havre de Grace. Is a dinner celebration. So contact Felicia if you have any desire to join us for that event. We'll invite all to join.
Yep, thank you for that announcement.
Thank you.
Yes, you can definitely contact me. Community is what Rotary is all about, and serving in health disparities, public health, building
There's,
bridges.
there's one other commentary I'd like to make.
Sure, absolutely.
And so it's just a commentary just to make people think, okay?
Okay.
So what's the underlying reason why Black women in the United States have a higher risk of maternal mortality and infant survival compared to the general population? If we think about it, we would both mostly realize that it relates to our historical, circumstances here in the United States, to the evolution of that circumstance. Because of that, subliminally, we're not really looked at maybe the same way in terms of our value as perhaps the patient that's sitting next to you. And we're trying to combat that. That's important. We all would agree that that's important. Um, we African Americans, and some people like the term black, that's fine, but we are African Americans because there are over 1 billion black people all over the planet. And each group of black people is a different type of black people. And our type of black people is the African American flavor. Now, here's the interesting thing. We see what's happening in Ukraine, and it's tragic. It's tragic. And even though there are some people in Ukraine, as well as Russia, who don't necessarily look at us as black people, as equal, but we still have compassion and empathy for the suffering that they're going through. And we saw the suffering that a woman went through when she was pregnant and was hit by a missile, and it killed her and her baby and her fetus. It was terrible. And as a result of that and other things, there are billions of dollars that are now already being allocated. The last time I saw was $13.6 billion to aid the Ukrainians. We are trying to develop a solution to help black women in a particular area of West Africa, where 1 out of every 10 women that you see will be dead from a complication of childbirth. And you would be amazed as to some of the dismissal comments that we get when we're trying to raise money or attention and everything about that. But ironically, some of the comments are even from our own people who even still don't look at the value of a black person in Africa the same as they would as a black person in America, which is something for us to look at internally. And as part of what you will later be seeing as a campaign that we're going to be unleashing to try and get people to recognize that, is we try to use our talents and skills as African Americans to actually connect with people in Africa so that we all black people benefit together. So that's only food for thought, but I can't
That's
leave without mentioning that if we're talking about obstetric care.
That's enormous.
Okay.
Because we need to, and we have the right to advocate for ourselves. We have so many professionals, as yourself and others, that have the
Absolutely.
that have
Absolutely.
the influence, that have the
Absolutely.
know-how. We must advocate for ourselves. And that's why we're glad for this safe space to be able to educate those around us of information that you may have or that you may not have. We must advocate for ourselves.
On the Washington Post, on the front of the Washington Post today, is a photo of a bunch of Americans who have flown off to Ukraine so that they could find weapons to help the Ukrainian military. We need to have that kind of compassion to our own people, that we would even help them with their own health care if they're in another country.
Absolutely.
We need to have that same compassion for our own people.
Absolutely.
Absolutely.
That's why we're here. This is one small step forward. And hopefully these arteries will continue to branch out into other areas of concern, because Dr. Samson, that's our heart as far as justice for all.
Right.
So thank you for that commentary.
Right.
Felicia, please. I'm sorry, we could go in the woods with this. We have 5 more minutes. Go ahead.
It's profound, and just as recent as today. I'm sorry.
Go ahead.
Yes. My business name is the Real McCoy Coaching Doula Herbs and Training Services LLC. I can be reached at 443-405-5544, or on Facebook by Felicia McCoy Laguerre, by my name. I look forward to talking to you. If you're interested in a doula, feel free to reach out to me as well. And I will be joining Felicia and Michelle again on here because I love, love, love to talk about prenatal care, maternal care. I also love working with young girls and teaching workshops, women on various business levels, teaching them about self esteem, about balance, about boundaries, about finance, and the list goes on. So it's not limited to those topics, but I love teaching and training and just connecting with others. So thank you, Felicia and Michelle, for having me. I truly appreciate this time.
Thank you, Felicia.
Thank you.
And to your credit, my daughter sat in one of your workshops this last Saturday, and you did a phenomenal job. It was called The Princess Within. I know that you didn't personally sponsor, but you were one of the speakers there, and how you related and connected to them was amazing. So yes, please reach out to Felicia McCoy
Thank you.
um, on her webpage, and we'll put that inside of our comments as well. And as we're closing, Michelle, I don't want to cut anything off if you wanted to say anything else.
No, I didn't have anything else to say, but I did want to make a comment how we saw on Edgewood Family how people were reaching out to look for OBGYN that was African American. And I promise you there were only like 2 that they mentioned in that in the comments. So we need anyone that knows any OBGYNs of
Yeah,
color.
I work with several African American OBGYNs who are excellent, the top of the line at Johns Hopkins. So
Right.
I will I'll make their some kind of contact information for them available to you and Felicia.
Okay.
Yeah. Yeah.
Thank you for that, Michelle.
So
Thank
needless to say, we don't have any in Harford County. Not many in Harford County, which we need, but it's okay. We have to step out of the county to get
That's right.
proper care.
Right.
Prenatal care is important no matter where you go.
Absolutely.
Yes, it's
Absolutely.
important no matter where
If
you
Upper Chesapeake wants to recruit some, they can always do so.
That
go.
would
But
be
until
Absolutely.
they
great.
do, we go where we
Absolutely.
need to go.
Absolutely. Absolutely. Thank you, Dr. Samson.
Hmm.
Absolutely. I also want to make sure that people know that you have to go a place where you feel comfortable.
Hmm.
You know what it feels like when you are being mistreated or disrespected. Red, yellow, black, and white. Okay. You feel comfortable. If you're not comfortable, advocate for yourself. Okay. There are places that you can reach out to. We are here to help. So Dr. Sampson, thank you so much. And I'm looking for that list because we want to be able to spread that information along, especially to those on Edgewood Family. Felicia McCoy, we know that we're going to see you in the neighborhood. So thank you so much for your time. And also
You're
Michelle,
welcome.
of course, my co-host. And that is if and please be mindful of the announcements, and we will put their information below inside of the comments. You all have a good evening, and that's our show.
Good night.
Thank
Thank
you.
you. Have